Welcome and namaskar. Joining us today is Dr. Satheesh Kathula, a nationally recognized hematologist, oncologist, healthcare leader, and the newly elected president of the American Association of Physicians of Indian origin. And, with over 2 decades of clinical and academic excellence, he's a passionate advocate for global health equity and a firm believer in lifestyle medicine. And Dr. Kathula is also the author of the inspiring book, Immigrant Doctors Chasing the Big American Dream, a compelling account of resilience, hope, and purpose. He is leading the 43rd annual AAPI convention this July, one of the most anticipated gatherings of medical professionals from across the globe. So let's welcome Dr. Kathula and welcome to ITV Gold.
Thank you. Thank you so much for having me today.
I want you to tell our viewers a little bit more about yourself.
Well, I've been a hematologist, oncologist for the last 23 years, and I'm from Dayton, Ohio, which is a mid-sized town in Ohio in between Columbus and Cincinnati. And I came here as a resident 29 years ago, and I've been here ever since. After I finished my fellowship, I started practicing here, hematology oncology. I'm a clinical professor at Wright State University Medical School in Dayton, Ohio. And we do have a fellowship program we participate in, our group does. And I've been involved with AAPI for about 2 decades, and in the governing body for about 15, 16 years. So I was the local chapter president, and then I became the regional director, state chapter president, and then I won 4 elections, including as a board of trustees, treasurer, secretary, vice president, and then I was the president-elect, and I became the president last year, July of 2024. In fact, I'm the not newly elected, actually, I'm the outgoing president of AAPI next month. But this year has been very eventful, and I can share those with you, going forward. So, and I have 2 wonderful kids, 2 boys, and they both are in medical field as well.
Wonderful. Let's start with the AAPI convention. And you are, of course, leading this 43rd annual convention, which is going to be held in Cincinnati in July.
Right.
So tell me, what makes this gathering so unique?
So it is, every convention is so unique, and this is going to be in Cincinnati, which was never held in Cincinnati, Ohio. This is the first time in Cincinnati the annual convention is being held. And we have very accomplished, very well-known speakers coming, such as keynote speakers like Nobel laureate Mario Capecci and newly elected AAPI president, American Medical Association president, Dr. Bobby Mukamala, and Michael Sook, Dr. Michael Sook, who is the BOT chair of AMA. And then we also have Federation of State Medical Board chair, Dr. George Abraham, and the president of that organization, Dr. Humayun Chowdhury. And we'll have entertainment, 10 hours of CME, and all the CEO forum, women's forum, medical licensing forum, medical education forum, and all these things are, to look forward to this year.
Absolutely. And you know what, Dr. Kathula, I want you to talk a little bit more about it. I know that AAPI's core mission is promoting preventive healthcare. So how are you incorporating this into the sessions and themes this year?
Well, there are so many things that we have, not only prevention but also the treatment. This year we have all the speakers coming, the world-renowned speakers, talking about GI interventions, talking about Ayurveda, how we can integrate Eastern medicine into Western medicine, and the lifestyle changes and things like that. So it's not just preventive, but also there are a lot of topics which are about the treatment.
And would you want to share more about the Indo-US collaboration efforts AAPI is championing through this convention?
Yeah, there are so many things that we want to do. We are inviting some political leaders and talk to them about the Medicare reimbursements, how to fix them permanently, and also how to really have these, H1 visa, the fast tracking of green card for them. And recently, we collaborated with AMA. AMA actually has done a wonderful job of getting all the J1 visa holders interviews, which were stalled because of the new immigration policies. So things like that, we want to really bring some legislative issues also in the convention. So we invited several legislators to come there and participate.
And with this healthcare evolving so rapidly, tell me, what's your vision for AAPI's role in shaping the future, both in US and India?
Well, AAPI is the largest ethnic physician organization in the country, and it is the second biggest physician organization after AMA. So we actually have, did the advocacy efforts on Capitol Hill last month. Actually, we met several congressmen, senators, and we actually went there with an agenda, and we asked them to really fix the Medicare costs and also fix Medicare reimbursement for physicians. And not only that, how to decrease the drug prices, how to make physicians and patients' lives better. So we really want to see the equity, equality in healthcare. There are a lot of people in the rural areas who do not have healthcare access. How can we really improve the access, and how can we really decrease the physician shortage? There are a lot of doctors that are needed. By 2035, we need about 100,000 physicians. So how do we really make that happen? Allowing immigrant doctors more so that they're already trained back home, and if they pass their USMLE and things like that, they can come here and practice with minimal residency requirements. So that's one thing that we are trying to do. And we are collaborating with AMA and the Congress and everybody to really take this mission forward. We need definitely more doctors in America. There are so many areas without any physicians and hospitals, and no healthcare access. People have to drive hours to get to a good hospital. So our goal is to really decrease the physician shortage, increase the number of physicians, and improve the healthcare access. And in India, we are trying to really do a preventive healthcare, and we did a big, global health summit back in October in New Delhi. We met health minister, we met NITI Aayog members to actually focus on preventive care, because an ounce of prevention is a pound of cure, better than a pound of cure, because when somebody gets a disease like cancer or heart attacks or heart disease, it's very hard to treat them, and it takes a lot of resources, a lot of money. But if we spend a fraction of that amount on prevention, we can prevent a lot of cancers, a lot of heart diseases. So that was our theme, and it was very well received. It actually really was published in multiple papers, and we went with a theme of lifestyle modification and technology in the prevention of cancers and heart attacks. That was our theme. And we met several states ministers as well to take this message across. And that had some impact. And also, we're advocating for certain specialties in India, such as emergency room, ER residencies, as well as family practice, because a lot of people who are actually doing primary care are getting into subspecialties or super specialties, what they call in India. And their intention is not to stay in primary care. Most of them, if they go into cardiology, gastroenterology, oncology, we have no physicians left for primary care, because primary care is very, very important for prevention of diseases. They can take care of diabetes, they can take care of high cholesterol, they can take care of all these lifestyle changes and hypertension, all that, and that can prevent a lot of disease like cancer, strokes, heart attacks, all those things. So that's why it's better to have primary care. So we have been advocating for family practice and primary care in India, and prevention has been our theme in the last year or so. And we are collaborating with an association called GAMES, which is Global Association of Indian Medical Students, and we are collaborating with them. And they are doing a lot of camps to make people aware of cervical cancer, which is mainly caused by what is called human papilloma virus. And how can we really vaccinate people for human papilloma virus because it is widely available, but people are not aware to receive that vaccine or to get their children vaccinated because it has to be done in teenage years before they're exposed to the virus. So that's how our efforts are actually making some impact. And obviously, 1 year is not enough. We have to just keep this mission going. Also, in the US, we are doing what is called stem cell drive. A lot of patients, Indian patients especially, we have a small donor pool for bone marrow transplants. If somebody needs, for God forbid, if somebody has leukemia, lymphoma, they're not responding to conventional treatments, if they're not responding, then we need to give them stem cells from other people. For that, the donor has to be a match. And the best chance of match is your own ethnic background people. So our pool for Indians and South Asians is very low. So this year we have conducted, AAPI has initiated this drive in multiple cities across the country. And we have registered hundreds of people to be in that donor pool. If somebody needs, they have a better chance now to get stem cells to cure lymphomas or leukemias, which are not otherwise curable by the conventional treatments such as chemotherapy or CAR T cell therapy. So these are all the activities we have been doing, and we are also focusing on education. We are encouraging research. We actually conducted a lot of webinars for CME, 12 webinars, and we gave almost 50 hours of continuing medical education hours this year, including the tours, collaborating with other organizations. And also we are encouraging research in India too. With the games, actually, we donated some money and we are mentoring them for research so that they have better concept, better idea about research. Without research, nothing moves forward, especially in medicine. We need innovation, we need research. And in India, it is lacking because there is no education, there is no awareness about research. So we are actually trying to educate the medical schools and medical students to do research from the beginning so that we can make a bigger impact with new innovations, new treatments in medicine. So that's one thing. And then also, we have done several webinars this year for pre-med school students and high school students, as well as the IMGs for how to get into residency. We titled that as a roadmap to residency, and we conducted at least 3 webinars to help them, to mentor them, actually. So these are all the things that we are trying to do to close that physician shortage gap so that we can get quality doctors into the country.
So, Dr. Kathula, would you want to give a message out to especially the younger doctors, how to join AAPI or why to join AAPI?
Well, it's very easy to join AAPI. Medical students, it's $50 and sometimes we give it for free. So get involved in organized medicine because there is nobody to speak for you other than AMA and AAPI from Indian physician standpoint. So I encourage all medical students, young physicians to come and join AAPI, to join hands with us so that we can collaborate with other organizations like AMA, other ethnic physician organizations. And when we have more people, our voice is stronger. So I would say unite all the physician organizations. So if you join AAPI, we'll do it for you. You don't have to do that individually, and individually we cannot do many things. So that's why I think it's better to join forces, and I encourage all the doctors of Indian origin, especially the youngsters, to join and take this organization forward and to make a meaningful impact in medical profession, not only for doctors, but also for patients.
All right, so let's talk now about your book, which I'm really interested in talking about, and that is about the immigrant doctors chasing the big American dream. So tell me, and it captures a powerful journey. So what inspired to write it now, and what message do you hope readers take away from this?
I've been thinking about this book for the last 10 years, and I started writing this about 2 years ago. And I'm an immigrant doctor, and I know the struggles. And a lot of people look at our success, what cars we drive and where we live, what kind of homes we live in. But nobody really looks at the struggles like, how much training we have to go through and what are the hurdles, learning, new culture, learning a new language. Though we know English, coming here and, the colloquial language and things like that, it's a challenge. Our accent and all that, people have to really trust us to really put their lives into our hands. And how do we really cross those challenges and hurdles to be a successful physician here? So everyone has a story to tell. And I thought of just publishing my story, but when I ran into several immigrant doctors, I actually got to know them really well, and everyone's story is so interesting. Everyone has a story to tell, and every story is so unique. So I just wanted to put all these stories together and publish so that people can read. It's not only for aspiring doctors to actually know what an immigrant doctor has to go through to get their success, to get to their practice that they've been hoping for. And also, this is for the practicing doctors to relate to what others have gone through. And, patients and other people, families, and a lot of people wonder, whenever they go see doctors, wherever, we are so visible, so obvious, not only Indian doctors, but doctors from other countries. In fact, every fourth doctor in this country is a foreign born and educated in other countries and who came here to practice medicine. So it is quite a significant amount of workforce. And a lot of people wonder, hey, how did these doctors came here? Not in a bad way, but they're curious to know. And a lot of patients ask me, because I know some patients for 20 plus years. They've been following me for blood-related problems or cancers. And they ask me, hey, doc, how did you get here? What kind of visa are you on? And how is your family doing back home? And how is the separation from family? So this is meant for all of them, not only for medical students coming from other countries like immigrant doctors or international medical graduates, the practicing physicians, and the patients and families who are exposed to all these immigrant doctors. So, it took me a while because I had to get interviews from 20 different doctors from 8 different countries, not just from India, but also there are stories from doctors from Bolivia, Colombia, Middle Eastern such as Egypt, Syria, African countries like Nigeria, Ghana, all these countries, the doctors who are these countries from who are from these countries actually gave interviews, and like I said, every story is so inspiring, so interesting, and so unique. So I hope our readers will read that. Thank you.
Absolutely, and as you said, you have definitely worn like many hats, from a physician, educator, community leader. So tell me, how much of that personal evolution is reflected in the chapters of your book?
Well, definitely. I wrote most of what I went through and what are the successes. At the end of the day, America is a great country to live, but the struggles are common. We all have a common thread. But I just put a lot of things, whatever I achieved, to inspire other people. And definitely that, because I've been in all these committees and organizations, I have a lot of connections. And, just looking at things in the hospitals or outside in organizations, I learned a lot of things. And I put most of that into the book. Also, my questions were kind of framed around the experiences and what kind of experiences the doctors went through. And every immigrant doctor is so accomplished in this country at the end of the day. And having said that, everybody went through all these, struggles and challenges. But definitely, whatever I have done so far in my medical field or in the community definitely helped me to write this book. So I look at things differently. What kind of things that they are giving back to the community, what kind of things they have done to their home country, which educated them. And a lot of us actually got educated for free.
Right.
We did not pay anything, especially in India and other countries too. And now things are changing. There are more colleges which are private colleges and things like that. But when I came here 30 years ago, most of them were government colleges, and you have to really enter through merit and things like that. So, and governments actually paid. And what are we really doing back, giving back to the society here, and also back to India? So those are all the things that I asked a lot of doctors, and most of them are doing something or the other. So that's really encouraging.
And where is this book, sold?
This book is sold in the U.S. Currently, and it will be sold in India. It's available on Amazon. So it's called Immigrant Doctors Chasing the Big American Dream, as you mentioned.
Wow.
And it's an easy read, chapter by chapter. So yeah, I mean, it's a 2.5 years work, and the editing and all that. I've been very busy with AAPI, especially the last year, so that got things delayed. But I'm glad that I'm able to publish this so that people can get inspired with the stories that they read. And these are all the inspiring stories and unique stories, as I mentioned before, from different countries. I also wrote a chapter about the policy and how we can encourage physicians from coming here legally.
Wow.
And also how to really give them training without too many restrictions, and close the physician shortage, which we really need. And there are a lot of physicians who are working in rural areas from Indian origin or other countries who came from other countries. And actually, without them, the healthcare will collapse in certain areas like Dakotas and other areas in rural areas. It's very, very important to encourage them to actually fast track their green cards, because people have been on H-1 visa for 10 years, 15 years without really knowing what's going to happen. They are in a limbo. They are in actually a very big dilemma. What if something happens to them? What's going to happen to their family? So that's why we have to really encourage. We have to, give them green cards within a short period of time, not pooling with other professions, because this is healthcare is very, very important. Also, I presented this book to a lot of legislators, and I'm planning to do this more and more in the next coming months. I went to Washington, D.C. I presented this to several congressmen, few senators, and I want to do this so that they are educated, they are aware of what immigrant doctors go through, and what needs to be done for healthcare in this country to close the physician shortage gap.
I want you to show the book to all of us and tell us where it's sold. Wow. Immigrant Doctors. Very nice.
So this is the book, and this is sold on Amazon. It has, the paperback as well as hard cover, and also available on Kindle, so people can read that. And also for medical students and IMGs, I'm planning to give some discount as well.
All right. So one more time, last time, I want you to again talk about the convention. Where is it going to be held? When is it? And what is it all about?
The convention will happen in Cincinnati, Ohio, from July 24th to 27th next month, and it'll be in what is called Northern Kentucky Convention Center, and it's right across the river from Cincinnati, Ohio. So that is a 3-day thing, and Thursday night we start with the cruise and our official meeting, and then followed by the CMEs, forums like CEO Forum, Women's Forum, Medical Licensing Forum, Medical Education Forum, and then entertainment, plus, AAPI Got Talent. That segment will also be there. It'll be an education, networking opportunity, as well as, entertainment as well, to have some fun. Plus, we also have a section for medical students and young physicians. We are inviting medical students to present abstracts for poster presentation, or the oral presentations. Also, we have what is called Medical Jeopardy. Just like the regular Jeopardy, we have a Medical Jeopardy with medical terminology, diagnosis, and treatment for younger physicians or medical students. And that'll be a fun event. So I would like to welcome everybody to Cincinnati from July 24th to 27th.
So where can they find all this information?
This is very easy. They can go to AAPI website, which is apiusa.org, or they can directly go to apiconvention.org, www.apiconvention.org. apiconvention.org. It has all the details, the registration and everything, yes. We are expecting about 800 to 1,000 physicians and healthcare leaders, and this is a great networking opportunity. And for businesses, this is a great way to showcase their business. And I would like to welcome everyone to be sponsors for this and get their business out there. Thank you.
And I would like to wish you all the best, and thank you so much for coming.
Thank you so much. Thank you, ITV Gold, and thank you especially for spending some time to get this message across. Thank you.
Thank you.